HPV, or the human papillomavirus, is a common sexually transmitted infection that can cause a range of symptoms and health problems. In this video, we'll take a closer look at HPV, its signs and symptoms, and the available treatment options. Some doctors believe that homeopathy medicine Thuja Occidental can cure HPV. Let's talk about what HPV is. HPV is a virus that can be transmitted through sexual contact. There are more than 100 different types of HPV, and while many of them don't cause any symptoms or health problems, some can lead to serious conditions like cervical cancer. So, what are the signs and symptoms of HPV? In many cases, HPV doesn't cause any noticeable symptoms, which is why it's often referred to as a silent infection. However, in some cases, HPV can cause genital warts, which are small, fleshy growths that appear on or around the genitals. These warts can be raised or flat, and they may be pink, red, or gray in color. In addition to genital warts, certain types of HPV can cause changes in the cells of the cervix, which is the lower part of the uterus that connects to the vagina. These changes, which are known as cervical dysplasia, can be detected through a pap smear or HPV test. If left untreated, cervical dysplasia can progress to cervical cancer, which is why it's important for women to get regular cervical cancer screenings. So, how is HPV treated? Unfortunately, there is no cure for HPV, but there are treatments available to manage its symptoms and reduce the risk of complications. For genital warts, a healthcare provider may prescribe topical medications like imiquimod or Podophylax, which work by stimulating the immune system to fight the virus. In some cases, the warts may need to be removed through procedures like cryotherapy, which involves freezing the warts with liquid nitrogen, or surgical excision. For women with cervical dysplasia or cervical cancer, treatment will depend on the severity of the condition. Mild cases of cervical dysplasia may not require treatment, but more advanced cases may require procedures like a loop electrosurgical excision procedure, LEEP, which uses a wire loop to remove abnormal tissue, or a cone biopsy, which removes a cone-shaped piece of tissue from the cervix. In some cases, a hysterectomy, which involves removing the uterus and cervix, may be necessary. In addition to treatment, there are steps you can take to reduce your risk of HPV and its complications. The most effective way to prevent HPV is to get vaccinated. The HPV vaccine is recommended for both boys and girls starting at age 11 or 12, and it can protect against the types of HPV that are most likely to cause cancer and genital warts. Other ways to reduce your risk of HPV include using condoms during sex, limiting your number of sexual partners, and avoiding sexual contact with anyone who has genital warts or other visible signs of infection. In conclusion, HPV is a common sexually transmitted infection that can cause genital warts and lead to serious conditions like cervical cancer. While there is no cure for HPV, there are treatments available to manage its symptoms and reduce the risk of complications. The best way to prevent HPV is to get vaccinated, and you can also reduce your risk by using condoms during sex and limiting your number of sexual partners. If you're concerned about HPV or have any symptoms, talk to your healthcare provider to discuss your options for testing and treatment.